So excited to be here with all of you today. Thank you, Helen, for inviting me. It's just a real honor to have a chance to share some thoughts with all of you. And also very grateful to see all of our colleagues from the Department of Health here today as well. We are in just such a fortunate situation in the Shapiro administration in that you have a set of health hub, as we call ourselves, secretaries who are deeply committed to working across our agencies and working together. We meet weekly. That's myself, Dr. Bogan from Health, Jason Kavulich from Aging, and Dr. Latika Davis-Jones from Dept. And so every week we meet and we are thinking about this work holistically and how we can work together to do it more effectively. And I also want to just give a big shout out and thanks to some of my DHS colleagues that are here. Our DHS Chief Dental Officer, Dr. Sean Shamloo, and I know he just walked in with me. I don't know where he went, but there he is. He's over there. And our Chief Medical Officer, Dr. David Kelly, who I'm sure, there he is. Okay, great. So say hello to them if you haven't met them yet. I know each of you play such an important role in keeping people healthy. Oral health is a key component of physical and mental health. And I just want to thank you all for what you do to make sure your patients and your communities are getting the care that they deserve. As a physician, I know how clearly linked a person's dental health is to their overall health and well-being. And we all know that dental health impacts many things, including the ability of job seekers to obtain a job, particularly if that job that they're seeking is one that faces the public. DHS is committed to making sure that all Pennsylvanians, especially the most vulnerable, receive high-quality, affordable health and dental care. For those of you I haven't had the chance to meet yet, I do want to share a little bit about my background and some of the experiences that guide my work. I was called into public service because as a physician practicing in Philadelphia teaching hospitals, I regularly saw that the health of my patients was being impacted by things outside of the exam room. To be healthy, so many of my patients needed stable housing, healthy air to breathe, healthy water to drink. And in so many cases, they just needed a grocery store in their neighborhood that they could get to that sold fresh fruits and fresh vegetables. And by the way, very clear on the fact that they didn't have access to those things and what they were eating negatively impacted their dental health. And as a physician, I could not write a prescription for any of those things. So these experiences really began a shift in my perspective. I knew I could help treat the immediate problem that brought somebody to the hospital or the doctor's office, but when the illness was being caused by or exacerbated by these external factors, I learned pretty quickly I couldn't cure the disease. So seeing these intersecting systemic issues like racism and poverty, lack of education, lack of job training opportunities, affecting people's overall health, motivated me to start asking how we can do better. I went back to school to learn more about public health policy, and one of the most important things that I came to understand and have really embraced is the importance that advocacy plays in developing public policy. This led me to join a group called the National Physicians Alliance, where I advocated for healthcare reform and promoted public engagement from physicians across the country at the national level in the run-up to what became the Affordable Care Act. And I eventually ran for office and served as a county commissioner for the past 8 years before being asked by Governor Shapiro to join his cabinet. I believe deeply in the role of advocacy and that it can play a critical force in driving policy and advancing change for the better. For people in positions of power to be effective, whether as a physician or now in my work leading our largest agency here in the Commonwealth, we must listen to the people that we're trying to help. And I mean truly listen and dialogue in a way that seeks to understand the root causes of challenges and work together on the best solutions. Many of the same barriers that keep a person from having access to physical and behavioral health care also prevent them from having access to good dental care and oral health. And I don't have to tell anybody in this room that oral health always ends up at the back of that line of physical, behavioral, and oral health. One recent tangible example of our commitment at DHS to addressing these systemic barriers to overall health care is that our Medicaid-enrolled dentists are now included in the list of providers who can bill for Medicaid patients experiencing homelessness. Street medicine allows patients to get the care they need by meeting them where they are. And this is often the first step to building a relationship of trust and helping that individual get connected to additional supports and services that might lead them to a more stable situation. Through this initiative, we aim to increase access to care for Medicaid beneficiaries and improve all health outcomes. We now also offer billable teledentistry services. We offer services through this program which are groundbreaking, including fluoride application, tobacco counseling, nutritional counseling for controlling dental disease, and oral hygiene instructions. This is yet another way that we can reach patients who have barriers to accessing preventive dental care in a traditional setting. These initiatives are about creating equity. And we often hear the words equity and equality used interchangeably as strategies to create fairness, but they're not interchangeable. Equity is making sure that a person has what they need to be successful. Equality is treating everyone the same. And equality can promote fairness, but it only works if everyone starts from the same place and needs the same things to be successful. Whereas equity works to make sure that each person has what they need or what each community needs in order to achieve that same success. Throughout much of my career in medicine, my experiences as a woman, as a mom, as a department chair in an academic health center, the focus was always on equality. And until recently, the public conversation was focused on treating everyone the same, to be colorblind, to not see a person's gender, disability, or other social identities. But as a society, we're finally starting to understand that that thinking was a well-intentioned mistake. In an effort to be fair, if we don't ask crucial questions or don't approach a person in a culturally sensitive way, we can unintentionally perpetuate unconscious bias and systems that end up harming people, not helping. We don't always see people as who they are and how their personal experiences and circumstances shape their lives. When we think about how to connect people to the support they need, we must understand that the underlying issues and barriers may be quite different for different people and different communities. And there's rarely a single solution that works for everyone. And I suspect that most of you very much understand that. An equity-minded approach acknowledges the challenges and experiences that different individuals and communities face. It seeks to problem solve in a way that fully and honestly considers the issues that are at the root of a problem and seeks to work and listen to those impacted in order to create lasting change. We will continue to prioritize meeting people where they are, to increase access to dental care and increase the number of Medicaid and CHIP recipients who receive dental care. Their health depends upon it. Increasing access to care can be generationally impactful. A 2021 study found an association between Medicaid adult dental coverage and children's oral health. The study found that adult dental coverage was associated with a significant 5% point reduction in the prevalence of untreated cavities among children after Medicaid-enrolled adults had access to coverage for at least 1 year. If that is the progress that can be made in improving oral health outcomes after just 1 year, imagine what we can accomplish with a little more time when we are all committed to working toward our shared goals. To that end, the CHIP program is working on a performance improvement project to improve access to pediatric preventive care. The baseline year for the plan was 2021, and final reports are due from the CHIP managed care organizations next year. Additional information is in the DHS Managed Care Quality Strategy, which is available on our website and includes measures and steps that the Office of Medical Assistance Programs is taking to increase dental visits for children. DHS is also looking at strategies to increase ER dental visits, which was decrease ER dental visits, which was a request from the coalition. We heard you, and we understand the importance of measurable recommendations from DHS that can improve dental care for both patients and for providers. Most recently, DHS released an updated medical assistance dental fee schedule, as well as a dental provider handbook. While DHS was supportive of an 8% increase for dental services, it was not funded in this year's budget, as I'm sure you all know. But we know there's still a lot of work to be done in restoring the adult dental funding to pre-2011 levels, when the program underwent significant cuts. We are committed to working with the General Assembly to invest in this critical program, and we encourage all of you to do the same. We look forward to continuing to work with you and other stakeholders to make the dental program a priority, to make sure that access to quality dental care is not overlooked, and to reduce or eliminate burdens to providers as much as possible. And I think one really important role that you all can play is that I continue to believe there's a real lack of understanding of the impact that dental health has on physical health. Most people really do not understand that. And when you start to sit with a lawmaker and explain to them about cardiac valvular disease, for instance, really catastrophic physical health problems that are related to poor oral health, people sit up and they listen. I think if someone's been fortunate enough to never experience that in their lifetime, they actually have no idea how tight that link is. And even something as seemingly straightforward as being able to chew your food and eat it and swallow it, particularly for our seniors and others. Just laying out some of these very simple things, I think would be very helpful for some of our legislators to fully understand that connection. And of course, the job data, which I referenced earlier, is quite clear. It's very difficult for someone to get a job who has poor appearance in terms of their dental appearance. So, go forth and carry these messages forward. We are not going to be able to solve these challenges overnight, but I firmly believe that we're moving in the right direction. We are committed to being a partner with you and for all Pennsylvanians to ensure that these vital services are provided, and we look forward to continuing this important work together with you. Thank you so much. It was really a pleasure to have a few minutes with you today, and I hope you have a great conference.